Hey, welcome everybody to the podcast series on innovative healthcare solutions that's sponsored by the Conference of Consulting Actuaries. So, if this is your first time seeing one of these, this is really a series of interviews we do with actuaries, clinicians, CEOs, and other healthcare professionals that's focused on delivering innovation in the healthcare space. These sessions are offered to really provide insights into what's going on in the ever-changing environment in which we live, particularly in healthcare. My name is Ed Pudlowski. I'm president of Morningstar Actuarial Consulting, and I'm also going to be your host for today's discussion. Now, we've got a great group of people here lined up for this interview, and I'm delighted to be joined by Ann Byman and Dr. Jeff Stanley from Verta Health. Ann and Jeff, thanks for joining us here today.
Thank you, Ed. It's a pleasure to be here. Thanks for inviting me to this conversation.
Yeah, looking forward to it.
Yes, I am too. So maybe just a little background for our audience here. Now, Ann serves as a commercial actuary at Verta Health, where she plays a key role in demonstrating the financial value of Verta's approach. Dr. Stanley is a practicing physician, and he serves as a medical director and senior clinical leader at Verta Health. So, Ann, I've got some questions for you, but I hope you don't mind if I start off with at least with one with Dr. Stanley and just provide some perspective here. Dr. Stanley, I know that Verta Health is a nutrition first-based solution to sustainable weight loss and diabetes control, but maybe before we get into that and a little discussion of your platform, maybe you can provide our audience an understanding of how big of a problem is this in the US with respect to obesity and diabetes?
Yeah, and that's a great question. And, again, just a bit more on my background. So I've been fortunate to work with Verta for more than 10 years and sort of have seen our evolution from, really initially focusing on type 2 diabetes and then expanding over time to address prediabetes, obesity, overweight, and just sort of metabolic dysfunction more broadly. And, to your question about how big of a problem is this, I mean, we know that now really the majority of Americans would be considered in this sort of metabolically unhealthy range. And again, that could include things like insulin resistance, and being overweight or having obesity. And then on that sort of a spectrum, then it moves towards the diagnosis of diabetes and all of the complications that go along with that. So it's not a niche issue. This is something that's really, affecting the majority of adults and even now a lot of, adolescents and children in the US.
Right. So now give us kind of an overview about what Verta does around, obesity and diabetes.
Yeah, so for just kind of a brief background, we're at Verta, we're really a specialty provider, and as you mentioned, sort of using this nutrition first approach to help people with this, metabolic dysfunction, whether it's overweight, obesity, prediabetes, or diabetes, with really a focus on ideally reversing those conditions. And when we say reversing those conditions, really what the focus is not kind of that standard disease management that, I think we're all pretty familiar with and
Right.
how I was trained in that, you add one medication for this condition, you add another medication for that condition. There's a focus on, getting people to track their numbers, but really not an intensive intervention. And that intensive intervention is what we focus on at Verta. So helping people to change their nutrition, to change their lifestyle through, becoming more active and exercising where possible. And, again, while that's good advice, the really important thing that I've seen over time is that to be able to actually achieve that, you need to have the ongoing support that we've really built. So what that looks like for an individual is, someone that I work with on, one of my patients, they have a licensed provider like myself that's overseeing their medications, their safety. They have a health coach who is working with them more on the daily nutrition, the motivation, the bumps in the road that are going to come. And then being able to, communicate with their care team fully virtually. So they can, through texting, through video or phone visits, from the comfort of their own home or their office, people can implement these changes because, what we see is those changes have to happen in the real world on a day-to-day basis, not necessarily, every 3 months in your doctor's office or at kind of a one-off visit.
So speak a little bit more about how you engage your members and how are you getting them to be able to how are they getting to those resources that you just mentioned and how are they using it differently than if the Verta platform wasn't there?
Yeah, again, so I mean, when I was a primary care doc for a number of years and would always try to talk with my patients about nutrition or about, making these lifestyle changes, but I found it was difficult, if not impossible, to be able to do that in a, 10 to 15 minute office visit and then see them back in 3 months if I'm
Right.
lucky. And so what we really have built is this, we call it a continuous care model, where when someone enrolls with Verta, they first have a visit with one of our clinicians to go over their medical history.
And
And
is this a virtual visit or an in-person visit?
so a virtual visit,
Okay.
yeah. And it's been interesting because I think especially, during the pandemic, there was a real move towards virtual visits, of course. And it's something where, when I first started with Verta, it was a bit of a novelty for someone to jump on a video visit with a provider. But we find that, people are used to it now. They're pretty adept at the technology. And also, again, it allows someone to have their doctor visit during their break at lunch. They don't have to take off work. They don't have to travel to the office. And so when they have that visit, they're enrolled, then they're basically using our app to interact with their care team. So they can
Okay.
message through this, HIPAA secure portal and ask questions about, oh, I'm going out to dinner tomorrow night. What should I plan on eating that's not going to spike my blood sugar or not going to, cause me to gain weight? Or, hey, I'm really struggling and I could use a little pep talk or some motivation and they're getting a response back from a real person that knows them that can give that insight, give that nudge where needed. And then in addition, we've built a lot of wraparound support to, what we'd like to say, sort of give our coaches and our providers sort of superpowers in that you can't do everything. So having technology and having some AI wraparound where, easy questions like, hey, I need to order more testing strips or I need to troubleshoot this, they can get those answers right in the moment. Or they can snap a picture of some food and immediately figure out, okay, how much sugar is in this? Is this a good choice or not? So it's kind of that combination of the technology, but I think importantly, the real people behind it, helping support you.
And how do you engage people, particularly those that are, in need of the platform that you had to try to control their obesity, to try to control their diabetes?
Yeah, so initially, if you want to sort of take it, to the kind of initial touch point, usually, we work with a lot of health plans and insurers and self-insured companies.
Okay.
So they would decide, hey, we want to offer Verta to our employees and dependents, and send out some marketing materials to sort of let people know, hey, this is a different approach. This is
Okay.
focused on disease reversal versus management. And then someone would, reach out, start an application, and kind of start the process towards being enrolled. And we found that it can vary a lot, as you can imagine, between different demographics. So if you've got a rural population or a population that doesn't use email very much, then you're focusing on things like mailers or break room flyers or things like that. So different ways to kind of reach people where they are. And then on an ongoing basis, if they've enrolled with Verta, there are direct outreach from their coach. So a message that comes through the app. If someone isn't responding and they've got a lot going on, we'll give people a call, kind of nudge them. And then we're also alerted if someone isn't logging or they're not responding, to make sure that we get in touch with them, so that, we can see those outcomes we're looking for.
So what percentage of that population that you really want to interact with are you actually having some connection with on your platform?
Yeah, so can kind of answer that a couple of ways. With regards to sort of the enrollment. So let's say again we work with a health plan or a company. Um, it can vary quite a bit based on how much communication is
Yeah.
allowed. So as you can imagine, some people say we don't want to bug our employees with 1,000 emails, or we only send out reminders quarterly or whatever it is. So there's a lot of variability in there, but I
Yeah.
mean, we've seen as high as 50%
Hmm.
of eligible members, with
Okay.
an employer or with a group. And I think usually somewhere probably 15 to 25%.
Okay.
Again, just varying based on how much, when we can outreach more, obviously we can, get help more people. And then just to follow up, once people are enrolled, we're seeing just under 70% retention at 1 year.
Okay.
So people that enroll tend to stay enrolled during that time frame, and we see the average is probably about maybe 18 to 20 months in terms of how long someone generally stays enrolled.
Okay, great. Well, you answered a couple of other my questions in everything that you did there. So I was going to ask about your markets. I was going to ask about how you maintain engagement with professionals. So I really appreciate that.
Oh, I
Uh,
can be a bit verbose, so if
no,
if I'm
no, no.
covering the other questions, and I want to make sure we give Ann a chance to talk as well, of course.
No, you're absolutely perfect, and I love it when my guests anticipate my questions because obviously that means you're anticipating likely what our audience wants to hear. So I appreciate that. So yeah, let's turn it over to you, Ann. So you have an analytics team. So tell me about Verta's value proposition. What makes Jeff mentioned that you provide your services to employer health plans and maybe carrier health plans. And then I think from looking at your website, I think you also work with providers as well. But what makes that market interested in Verta beyond just the opportunity for health improvements that Dr. Stanley referred to already?
Yeah, it's a great question, Ed. So I think like starting out, I think everyone could agree that anecdotally, we would expect that with strong clinical programs, reaching out and engaging members, you're going to drive clinical outcomes, which will result in savings. But we can't rely on just anecdotal evidence and just say, well, we assume this is working.
And I'm sure the people you're trying to market to won't rely on that either,
Exactly.
right?
And I would say even more so, the scrutiny is higher than ever because we're in a tough economic environment.
Yeah.
And plan sponsors and health plan partners and anyone who's evaluating a partnership or an investment in Verta Health is looking at this like, how are we going to ensure that we're coming out ahead? That what we're going to invest in for our members isn't just creating an amazing member experience, which is important, and they're getting their goals, but really importantly, that we can justify this on our bottom line. And so I think really where you're going with this question is like, how are we articulating this value? What are we doing to measure this? And it's a really important question. I think as actuaries, we have a really important responsibility in how we are looking at data and attributing savings. We could look at a set of data results, and depending on how we interpret those results and how we communicate those results, the buyer, the audience can have different interpretations of how it'll impact their population and their bottom line. And so we actually have a pretty important responsibility in how we are articulating that and how we're conveying that to the external audiences. So with that in mind, I think a big part of our focus is using rigorous statistical approaches in quantifying savings, leveraging independent and third-party groups to validate what we're doing, and like very fundamentally relying on data to drive what we're telling the market. Verta is a very data-driven organization, and it was a strong appeal for me as a credentialed actuary to go to a place that is really data-focused. And so, for example, and I know, Ed, CCA had an interview with one of my colleagues and Dr. Stanley back at the end of January. And in that webinar, there was a good amount of discussion on like a case study that had been done by Verta a few years ago. So I won't go into details on that case study. But just to highlight for today's conversation, doing a very rigorous case study on our deployments and analyzing what's the actual claims impact on the support we're having on members is a really critical step in articulating here's our savings value. So that was done, and there's ongoing claim studies. We do difference in difference studies on our existing clients to with propensity matched control groups to determine how are those supported by Verta, what does that cost trajectory look like compared to those who are proceeding with like typical usual standard of care. So those are some methods to really demonstrate the value. But as I mentioned, like the external validation is also a really key component. So we have a study that was co-validated by Milliman. We have validation of our medication deprescription and the resulting cost effects that was validated by Validation Institute. We have PHTI that did an overview of our clinical outcomes and our overall methodology. And there's very favorable results from Verta on the Verta approach. So I think those are like the underlying that gives me confidence as an actuary that we're taking the right approach here. We're using actuarial standards of practice. We're leveraging external partners to ensure that we're looking at the data appropriately. And then ultimately, as actuaries, it's really that look in the mirror test too. You know, as we hear about in our continuing education courses, is that are we taking this responsibly? Are we taking this responsibility appropriately in how we're measuring our savings?
Yeah, cost avoidance is always the most difficult aspect of trying to validate a savings model. But and you talked about the data that you get. Do you collect data on each and every client, or some of these studies are ones where you're just you're finding a willing partner in your clients to work with?
Yeah, it's a great question. It's a combination. So we
Okay.
always have data on our A1C reduction in our supported population. We also have information on weight loss. We also information on medication deprescription. So that is core data that we have for across our deployments. When we think, I think what you're referring to is like underlying medical and pharmacy claims feeds. And we do secure those for a subset of our clients
Okay.
where we're doing like those very rigorous differences in differences, propensity match cohort analyses. So we are able to secure that information in those situations.
Okay. Now you talked about kind of the A1C levels and the amount of weight loss. How are you getting that level of information from the members that you serve?
The actual information is coming through. We have so the maybe I'll give you just like a quick overview.
Sure.
When members enroll in Verta, they're sent a startup kit and they're given all the tools they need to be able to track and monitor and input their information. So they're logging their glucose as appropriate, they're logging their
Okay.
ketones as appropriate. They have a Bluetooth connected scale to monitor their weight, and that automatically gets uploaded to the portal. So there's a lot of inputs that are both member driven by them doing their injections or their blood draws or their pokes, and then also just some of the other things. As appropriate too, we are able to send members to get labs. So, you know,
Okay.
blood pressure readings and things like that. Cuffs are sent out in some situations. We can get particular lab readings from our lab partners. So there's a lot of ways that that data comes in through Verta. And then we are, you know, tracking and monitoring. And then on an aggregate basis, we're able to see this data across our book of business.
Okay, great. Thank you. That's exactly what I wanted to hear in terms of how you're doing that. So, how do you keep the lights on at Verta? You know, how do you charge for what you do?
Yeah, we charge per engaged participant per month.
Okay.
And
Okay.
so it's not like we're not paying, a plan sponsor is not paying for their entire population. They're only paying for those that are actively enrolled and engaged on a monthly basis. And
Okay.
so, although like perfect scenario, you know, everyone stays engaged the entire time, in reality, there's going to be those that kind of are dropping off. And so then there's a process in place to outreach to them because not so much from a billing perspective, but you think of it from a clinical safety.
Right.
protocol perspective, like we are a metabolic disease center of excellence, and our providers are caring for these members. And so if we aren't getting the interaction and with the members, there's a safety consideration, especially as we're actively and responsibly deprescribing medications. So there's a process in place if we're not having the engagement with the members. And then, and Dr. Stanley, you could speak to this more eloquently, but then at some point, if they're disenrolled, then we don't bill for that member.
Okay.
Dr. Stanley, would you have anything to add on like from a clinical safety perspective and what that process looks like?
Right. I mean, you pretty much nailed it. I think you could be an honorary member of the clinical team if you're interested. Um, but yeah, I mean, I would say that that's probably a big differentiator overall with Verta, and something we've heard in talking with clients or prospects is in the past there was just this sort of, per member per month, not engaged. They didn't have to be enrolled in the program. And so you're getting charged, maybe it's a smaller amount per person, but it's for everybody that you employ. And there's not, I think, the same um, shared motivation to enroll as many people as possible. We at Verta, we want to help as many as people as possible. We want to get those folks enrolled. The employer has also that sort of shared skin in the game to help their employees as well. But we also can sort of reassure that, hey, if someone enrolls and either they decide it's just not the right time. I mean, that's what we sometimes see is someone has a life event or something, illness in the family or just a reason why it's not a great time for them, then, we can disenroll them. Or if they are not engaging or logging, we're trying our best to outreach to get them back engaged, but we're not going to charge for someone who's not utilizing the program. And then the only other thing I would just add on to some of Ann's great points is that, I mean, one of my favorite parts of my job is I get to report back our clinical outcomes to our clients. And we start actually at 90 days after we roll out, once there's sort of a cohort of members that have enrolled and been at least 90 days in treatment. And we report back things like the A1C improvement, the weight loss on the connected scale, the meds that they've already come off of. And we do that at the 6 month mark again, and then at a year. And then at the year point, if again, we can get the claims data, which we're typically trying for, we can sort of reconcile that with the client and show, hey, this is what we've been showing since day 90. Here's how it coincides with the claims savings that you're seeing. So we really do try to be rigorous about that and, give people an early taste of what they can expect and then really work with them to say, okay, this is what you should be seeing. This is what the claims data shows. And, this is what we're proud to be able to offer.
Great. Thanks. So there's obviously any discussion about weight loss, I think, would be um, we just can't help but talk about GLP-1s, right? So maybe if you can, either Ann or Jeff, whatever, maybe give kind of a perspective on how your advice around GLP-1s exists within your platform.
Yeah, if you want, I can take this first and then you can add on, Ann.
Perfect.
Okay. Yeah, so obviously, I mean, it's been just a huge shift over, the past several years. And, it's interesting because GLP-1s have been actually around in some form since sort of the early 2000s for diabetes, but they started off with some earlier versions, like Byetta, which were
Right.
helpful but not particularly powerful. They showed a little bit of weight loss, which was actually kind of a surprise signal. And then over time, they've just really gotten more effective and more widespread. And so we've seen over the past few years that with the addition for obesity treatment, with the new medications like your Zepbound or Wegovy, that obviously the use of medications for obesity treatment is skyrocketing.
Right.
But interestingly, we've also seen that has brought up the diabetes usage as well. So obviously, you can't turn on the TV or the radio without hearing 6 ads for a GLP-1. And so whether someone is overweight or obese or has diabetes, there's more interest in these meds. And, I think the trend last year, I saw at least one stat that it was, something like a 30% year over year increase. And that's hitting the, co-pays and people's premiums, and then of course the costs for companies. And so, what we've seen is that there's been this sort of opening the floodgates, a lot of people covering GLP-1s, a lot of people wanting them, and then sort of a backlash of we can't afford this. We have to either put something in place to sort of, moderate this, or a lot of people honestly are just saying we can't cover this at all. And where we have sort of fit in this is that we really believe that nutrition is the foundation, and that these medications can be an effective tool, of course. But what we really want to do is set people up for long-term success, so that when they're on the med, if they want to take it, they're going to get weight loss that compares nicely to the clinical trials where people are losing 15-20% of body weight. But also some people actually don't want the med. They want to lose weight, they want to get healthier, but they don't like the idea of having to take a med every week or regularly, or they don't like the injections or the cost. So we
Right.
offer that alternative. And then finally, I would just say we offer an off ramp. So one of the things that typically we're seeing across the country is the idea is if you start a GLP-1, you got to be on it for life. Otherwise, you're just going to regain the weight. And
Right.
so we have some published data that's contrary to that shows that people actually can maintain their weight loss after stopping the med if they have that nutrition support and that
Right.
ongoing intervention. And so it's finding the right person. It's not to say everybody's going to be able to come off. Not everybody's ready, or not everybody has hit that point. But a lot of people can use the meds as a tool and then transition off and, have a sustainable, healthy lifestyle and sort of, free from the meds.
Right. Right.
Yeah, that was great. Thank you, Dr. Stanley. I'd add in, like, from a plan sponsor, from a cost perspective, maybe one of the most painful things for a plan sponsor is that members who are taking GLP-1s, pardon me, aren't necessarily taking GLP-1s consistently. And so there's people that are cycling on and off the drugs. And what happens in that situation is they're paying for the drugs. They're not getting the benefits of the drugs because the members aren't losing the weight. They're with the, kind of the weight plateau. They're not also getting the downstream medical and or health benefits. And so in so many ways, a lot of that GLP-1 spend is wasted spend when members don't get the support they need to be able to take the medications appropriately, manage the side effects, and like work towards those weight loss goals which drove them to start the medications in the first place. So that's
Mhm.
that's the first part. And obviously, Dr. Stanley talked about like our clinical approach in supporting members, but I think what our strongest from a financial perspective, our strongest value prop with regards to GLP-1s is that we are able to steer away members from the drugs altogether, like as members are seeking a nutrition only approach and still get the best outcomes. And then the off ramping. So that's direct savings. Like we're able to lower that utilization of the GLP-1 drugs. It's tricky, Ed, to be honest. It's tricky to like appropriately project this because there's so many changes in this
Right.
marketplace. We got in 2026, we have introduction to 2 new oral GLP-1s. So historically, in the past, plan sponsors have seen anywhere from like 40 to 175% year over year increase in GLP-1 utilizers. So strong acceleration. We're now facing a point of like maybe some deceleration because it's been rising so rapidly, it's plateauing, but now we expect a re-acceleration with the orals. So how do you like appropriately project what that utilization would look like in the absence of Verta? So it is tricky. We work really closely to fine tune our assumptions with our audiences just to make sure it's an appropriate reflection of where they are and that GLP-1 maturation cycle.
Right. Yeah, and I can imagine too that the experience of people that are on GLP-1s that choose to drop off them because they don't like the side effects of them, and they don't like that as being kind of a long-term lifestyle, can really utilize kind of this nutrition-based approach that you offer.
Yeah.
Really, thanks for your time today. I'd like to encourage our viewers who also participate in our healthcare community within the CCA to continue any discussions about some of the insights that's been shared here, and do that on that platform. And if you're not a member of the CCA and you want to consider joining to not only experience the benefits of the community platform that I mentioned, with these types of informal discussions, but all the other great benefits, then just go out to the CCA website, ccactuaries.org, and you can sign up pretty easily. Ann and Jeff, thanks so much for being here today. You shared a lot of great insights, a lot of great information that I know our audience is going to enjoy, particularly about what you're doing with the Verta Health platform, and really driving kind of innovation in the healthcare space. So I'm sure our audience benefited from this today, and I know I did. So thanks again for being here.
Thank you, Ed. You asked the right questions. These are hot topics. It's super important discussion. So thanks for inviting me to be a part of it.
Thank you.
Yeah, thank you so much. I really enjoyed it.
Thank you.
Take care.